BBC News.
It's 28 minutes to 8 GMT. Welcome to the World Today from the BBC World Service.
Now, over the past few years, there's been a dramatic jump in the number of birth defects in and around the Iraqi city of Fallujah. Now, there have long been suggestions that the cause of genetic damage there might have been weapons used by the US military during the fighting around the city. Washington's always denied those claims, but a new report due out next week is likely to challenge the US position. Well, I spoke to Mozgan Zarabi Asfahani, a US-based environmental toxicologist who helped write the latest study.
Basically, our study is the first study on birth defects in Fallujah. There's been other anecdotal stories about what is happening in Fallujah, but we have documented. We actually send out surveys, and we documented a number of birth defects in the population of Fallujah. What it tells us is that in the 4 families that we report on, which are families that have had very long history of reproduction, it tells us that the birth defects started appearing after 2004 bombardment of Fallujah. It's telling us that clearly an epidemic of birth defects is unfolding in Fallujah.
Well, you say an epidemic. What are the kind of numbers and proportions we're talking about here?
We are only reporting on 4 families, but it is a part of a larger study of 55 families that all show birth defects, congenital birth defects, in families that previously have never had any problems in the immediate family or in the extended family. So these are families that have never ever had any problems before 2004. They have been reproductively active, some of them as far back as 1982, with absolutely clear record, no problems. And all of a sudden in 2004 and after, they start having massive problems.
All right, well, what about the potential causes for this? Well, what are you looking at?
The potential causes, what we know for now is that it has got to be some chronic exposure to some kind of a environmental pollutant, something that is in the environment now and people are chronically exposed to right now, which they weren't before 2004.
And you suspect US weapons that were used during the conflict?
They are definitely a possibility. Depleted uranium could be a candidate for birth defects such as this. It's been seen in other settings. But it could also be something else, some other metal in the environment, some other factors that we're unaware of right now.
So the next stage of the investigation is to try and pin down the cause, I guess?
Yes. And what we're hoping to be able to do is to reach out to more scientists to get more support so that we can continue our work. The people of Fallujah are exposed to something that is affecting them chronically. Maybe the environment needs to be cleaned up. Maybe other steps have to be taken to alleviate this problem.
Mozgan Zarabi Asfahani. Well, we did approach the US government to find out what their response to this was, and the US Defense Department, the Pentagon, gave us this report.
The Department of Defense is aware of press reports and various studies in years past that looked at potential links between public health in Iraq and military weaponry, specifically in Fallujah. While we are not aware of any recent studies, the Department of Defense takes public health concerns in Iraq very seriously. The Department will continue to assist our Iraqi partners to improve hospital and healthcare management and services to provide better short and long-term health and welfare for the Iraqi people.
And we voiced up that statement from the US Defense Department, the Pentagon, in response to that report about genetic defects occurring around the city of Fallujah in Iraq.